I kindly ask all our partners that are present, Nuno, Vasco, Lopes, to turn up the camera. It's their opportunity now to intervene. And José Antonio Silva, also please turn the camera on, and the partners. We'll thank you, of course, all the participants and all the villagers for their interventions. And it's good to be able to be on time here for the closing session. And you are welcome to stay also. José Mendes Ribeiro, you are welcome to stay in the closing session as a good friend and an esteemed former healthcare leader, and also in the Ministry of the Healthcare in Portugal, or now in the private sector still, the CEO of the, and I don't know if Alexandre also in line. Okay, so let's do a roundup of preparation while we wait for the presence of Teresa Luciano to join us here in a few comments, and Carlos Cardoso, I'm not sure if also is on board here. But Nuno, Vasco, Lopes, welcome to the session. Have you been watching from the start?
Hello everyone, hello Paulo. Once in a while, because I've been all morning with other meetings, okay. But in the meantime, I was able to catch some good interventions, especially in the panel of Gabriel Coimbra and Ricardo Gil Santos. I enjoyed very much that panel. It was fantastic. Just some remarks on this event and on these 2 days. We are living now in a period of lots of uncertainty. Okay, and I think this is very important for us to understand some things, some actions that we didn't take in the past, and we had to take in a very short period of time. Okay, so uncertainty and speed of change are two main factors for the period that we are living. But these times we need for taking hospital care inside the patient's home, and that this is very important. Okay, in this pandemic period, this was clearly a priority. Okay, the modern hospitals they need to prepare to form a part of a new generation in the healthcare services and become virtual and borderless. I think this is very important, and this group, the Health Data Forum, has the know-how to bring together the state of the art in terms of the healthcare. And I'm sure that all the discussions were very important to build up some strategy in terms of this big change that we have to implement in the market. This was a group of very good people, extraordinary people that understand and defend constantly the joining of technology and health sector, and this is quite important as a solution for more equity and control costs, and mainly better healthcare outcomes. Okay, this is very important. The way we measure everything we do, it is very important to deploy success in the near future. So our view in this area is that medicine should be increasingly personalized, not only in terms of the genomics, but also in terms of the AI, the artificial intelligence, to prevent people to get it sick. Okay, and see all the system of the healthcare as a global point of care, that wherever the patient is, healthcare will be with him, and without the need of the patient to move to get the right care. Okay, so when I started to discuss this with Paulo Nunes de Abreu, the goal of this summit was to combine the different perspectives of data scientists, healthcare professionals, patients, and the responsible to take decisions, the politicians, to find the much needed consensus in the next generation healthcare systems. So we discussed big data, we discussed how can we empower clinicians, patients, all the stakeholders in the healthcare market to develop better therapy access and improve care for patients. And we've been speaking about the focus in the patients in the past, and now is the time to do the actions and to do everything that we have to need to put effectively the patients in the center of the system. So I like to highlight one theme that I believe that is the base of the next generation technological solutions for a better health. Okay, as I explained previously, the accessibility of people to healthcare services and the healthcare system is already, we have already lots of good examples in Portugal and across and in other countries also. And we see that not only in public services, but also in private services and involving everyone, providers, payers, all the government also. And this will allow the citizens to contact with healthcare services more easily, more closely. And this is very, very, very important. We can speak about the new internet, we can speak about IoT, we can speak about artificial intelligence, but this is now, okay? And we have to have the capacity to integrate all this knowledge to get better healthcare services to the people, to the patients, okay? But I like to emphasize other things, is that there is something, in my view, in our view, that will never is never replaced by machines. Is the human relationship, okay, and the role that is always reserved for the healthcare professionals. Major stakeholder in terms of the strategy in terms of healthcare, and the relation between the professionals and the patients is key for the success of whatever strategy that we have. Technology is important, okay, very important, to improve the processing of the information, all the information that we have, and the capacity to have faster and better response in real time, and this is very, very important, in real time, to be able to make better decisions and save more lives. So, Paulo, just to close, I think this event was a success, and we are preparing other events throughout this year. I don't know if you already spoke about that, but I'd like to thank you and to Hospital do Futuro, Paulo Nunes de Abreu. This was a fantastic job, and I think most of the people know Paulo, and Paulo is a very energetic person, and his energy is critical for the success of this event. I'd like to thank you also to all the other guests and speakers that we had in these 2 days, and thank you all. Well done. This was a fantastic event, and I'd like to thank you also to all the participants, not only in this platform, but also in the social media, because I had lots of people speaking to me that this event is running in Facebook also. And just to finish, just to say to all of you that it was a great honor for Glintt to be a part of this event. Thank you all. Congratulations, Paulo.
Thank you so much, Nuno, but don't leave behind, because we're still now ahead of schedule, because we have still a few minutes to round up. And you, unfortunately, our Secretary of Healthcare of Azores was called to the plenary, and she just called me that she cannot make it, and apologize for that. She will send a wish for us. So maybe, Nuno, you can officially declare this over in a few minutes. Let's open still the floor here, because this forum was so lively and so participated, and we have now more than 1,000 views in Facebook streaming, which is really, for me, a pleasure to see that health data is attracting the interest of so many people. But since we have here also some of our funding partners, maybe Alexandre, Antonio also want to share a few words with this audience. It's now your time and an opportunity to do so.
Good morning to everybody. My name is Alexandre Guedes da Silva. I'm the president of the Portuguese Multiple Sclerosis Society. In behalf of the patients, I want to congratulate Hospital do Futuro and Paulo for putting the patients on board, and especially to give us the floor to express our thoughts about this important aspect of our lives, the data and the data collection, and especially the data use. For us, in particular for a so difficult pathology like MS, data is everything. We are struggling, or the scientific community are struggling to understand this disease for more than 100 years. And we believe that they need help. And the help we can give to them is our data to be properly studied, properly used, especially properly manipulated by artificial intelligence systems in order to understand how all these processes in multiple sclerosis occurs, and especially because we are unique patients. We are 200 million in the world, unique patients. Every one of us has a different print of brain lesions, and so we are all different. And that's a challenge that only a strong community of researchers and a strong data lake would help to solve this problem. And the same is what we feel from our colleagues from the other pathologies, from the other patient associations. We feel that data is a key to find the cure to our diseases. And so we welcome very much this organization, and we are keen to be partners and to be participating on it. And God bless all. Thank you very much.
Thank you so much, Alexandre Silva. It's so interesting to see Nuno Vasco Lopes to say that the patients will be at the center, and we also have a partner of this Health Data Forum, a patient association so active and innovative and like yours. And it's really an honor to have you here in this conference as well. So we have still a few minutes to go on the roundup. Maybe José António Silva from DevScope wants to share something. And then I see Gerard, also some, Gerard de Bourbon was here also, and maybe could comment something. And then of course, José António.
Sure. Thank you, Paulo, and congratulations for the event. We are very honored to be helping lead this discussion around data. Our background comes from analytics and AI, and we've been hooking this data together with many of the institutions and partners in this forum. And we have a lot of concerns, of course, because we feel the pain of trying to get data from these different systems and trying to make some reasoning about that those signals and how we can help practitioners, institutions better manage their resources and better serve the patients. We've heard today things like the doctor having to use 5 different passwords to access applications to do their work, or different institutions having different procedures to collect data, and then having a lot of difficulties to create these data lakes to federate this data and do mining and machine learning on top of it. And this is the kind of problems we've been struggling in for many years. And we truly believe that we need to do something as an industry to start putting the discussion on the right place. And we've been seeing a lot of discussions around apps and applications for everything, and everyone wants to do new apps, and several countries have lots of different apps, but that won't solve the problem in the long term. We need to put the discussion also on the data, and that's why we want to help this kind of forum and we hope to have more opportunities to discuss the solutions, the technology solutions we have nowadays, how we can leverage all our experience and create better protocols for the future, better ways of integrating the data. And I hope in the coming years, every time we have a problem like this, we start also, not only with apps, but we start also with discussion with the ecosystem around how we can integrate stuff. So putting the contract, the data contract from the beginning in the discussions may help a lot to create solutions that will help us not only in our region, but across other regions. For example, maybe we will have an app to control our COVID situation individually, but that won't be helpful if we need to go to Spain or any other country in Europe, and that information won't be useful. So having lots of different apps will be even worse than having a proper federation to exchange data, exchange semantic information from country to country. And of course, all this discussion, and this was very well identified in this forum, all this information is owned by the patient, and we need to make sure that the consent and the GDPR rules are being preserved for all these utilizations that are being built based on the data being collected for many, many years. Thank you very much to Hospital do Futuro for making this possible. And thank you, Paulo, for the excellent organization, and hope to help more in the future.
Thank you so much, Antonio Silva. I see that we have now also here Rocha from Novartis that unfortunately could not attend us today. But maybe first I have also to give the word to Carlos Cardoso from Sectra, is also online. And Carlos was having issues because his company Sectra does not allow to use Zoom. I don't know how you managed, Carlos, but I'm so pleased that you are here on Zoom. So Carlos Cardoso also to take a little bit of the stand. We have still time until the official close that will be in a few minutes at around of the hour. 12 o'clock in Lisbon time, 1 o'clock European time. Carlos?
Hello, good morning, and thank you very much, Paulo, for taking care of us, made it all, basically. It was, I think, the first experience and quite a good success. Some things need to be improved, but overall, I think it was quite good. The information I took from this is that, in fact, we have a lot of data. We still quite far away in terms of standards, and standardizations are two different things. We know what standards are, but we are far away from standardization. Each country, each hospital, each entity has their own way of classifying, coding, and stuff like that. And that is very, very hard, makes very, very hard to do something that is different from integration from standards. That calls interoperability. Just imagine that each of us just define how our email works. No one will be able to interact with each other. So I think we have a long way just to convince people that this must be a little bit less democratic and a little bit more imposed to be sure that everyone can talk with each other. Besides that, I think we definitely are on the good way. We have a lot of things and a lot of people, a lot of smart people working on this. And I hope that in the near future, we'll be able to offer our doctors and nurses something easier to use, and they feel that they are useful for them. I have the luck of working in an environment. I work for PACS with the PICS administration, PICS systems that archive images for hospitals. And in that area, we are using standard for more than 20 years. So for us, it's quite easy, I would say, to talk about sharing information and sharing images between countries, between any place in the world. That's not the case in other areas. So I think we have a long way to go, but I think we definitely are on the good way. Thank you, Paulo, for taking care of us. And thank you all for participating.
Okay, it's really a pleasure. And I thank you also for your kindness here and kind of words. I thought before giving also the intervention, I'm not sure if GS1 is someone here from GS1. if there are cameras from GS1, then
I am. Hi, good morning.
a few words then, please.
Well, I will represent João as he isn't able to be here today. First of all, thank you for the organization. It has been an amazing 2 days. We have learned a lot. One of the words that stood out during the presentations was standardization. So even Carlos now mentioned the lack of standardization, and GS1 works a lot with standardization. So we work with third parties to help improve the globalization of information, should it be retail information or healthcare information. So I come out of this forum with the idea that we still have a lot of work to do. GS1 is still an important player to achieve these goals of a standardized global information exchange. And another word that came out is obviously telemedicine, and how we adapt so fast during this pandemic. So we are able to achieve these goals. We just need to set our minds to it. And as I heard throughout the days, we need to focus on one achievement and work towards it, and all together we'll get to the end goal. So just a quick word. I guess João would agree with me. And once again, thank you very much for the organization and the opportunity to assist.
Thank you so much, Madalena. It's always a pleasure to have also GS1. And it's interesting to see how the constellation of the summit partners fits together like in a magic puzzle where all the pieces are together. We have patients, we have data scientists, we have integration and standardization. So it's really interesting, and I'm really excited to see what the future can bring to us. I call now to the also a brief intervention, Luís Rocha, board member of the Novartis group in Portugal, and Marta Sasses. He was not able to be with us yesterday. He's now here with us to do an intervention. It was really an honor to have a summit partner, online summit partner, Novartis, because they brought also a fresh thought and fresh approaches that were, I'm sure, seen by everyone in Facebook stream. Luís?
Thank you, Paulo. Do you hear me?
We can hear you loud and clear.
Yeah, okay, thank you. So first of all, a big thank you also for your drive and your initiative to bring this discussion up. I think these open forums are really an added value where we get together from very different parts of knowledge and different parts of actually entrepreneurship. So this actually is quite positive that we have find these spaces to discuss. I think we've probably studied this discussion on digital and data for too many years with not too much progress up until very recently. And I think we have, and there's been, we can really number a lot of arguments that have been put forward not to move faster into this digital space in technology in healthcare. One would be the regulatory one. Another one would be the privacy and ethical. The other one will be technological or costs. Stakeholders will say, well, this is also an issue of literacy or complexity, and someone will be, this is an impact on patient-physician relationship or patient healthcare professional relationship. I would say I just would add one as hype and over promise. In some cases, we have the duty to make it work and to make really use cases where we do provide impact for patients. And once we have this, I think the demonstration is done. But I would think this really the biggest challenge right now is really one is cultural, and the other one is leadership. The rest will follow. I think that one of the culturally in the sense that. Because digital and data is going to transform the way care is being provided, there is different stakeholders that will perceive this as this revolution as one of opportunity or one of threat. It's obviously is one of transformation. So I would think that I think just the recent events, really, this crash course we have all of us have done to get ourselves up to speed in the digital front. Just I have shown you that this can be an accelerator, and there's too much risk of staying the same. So basically, we are now thinking about new ways of providing care. We are now thinking on new ways of, getting patients in front of physicians and monitoring patients remotely. So I think this probably it's not for the best reasons, but for these unfortunate events, I really will have an impact in terms of acceleration technology here. So this is something to consider, and we need leadership also to bring the discussion back to one specific point. And the only way that we can get consensus when we are moving things around in terms of opportunities or threat is really to bring back the discussion on the value that we are bringing to patients. And once we get there, I think we have much more alignment on this one, from providing insights into basic and clinical research. We have on personalizing care and interventions to make them more safe and effective. Also, re-engineering the process of care using these new tools to bring communities and patients closer to doctors and healthcare providers. And also using data as a way to measure effectiveness and costs of treatments and interventions. So there's a lot of opportunity. And my takeaway message from the different rooms I was today was really Portugal is actually in a very unique position when we approach the Portuguese presidency of the EU next year. And we have a single opportunity here to really promote this debate, which is actually because we have already a combination of factors which positions us quite nicely in this debate. So we have a good care infrastructure in one hand. We have a good data infrastructure developing. We have already telehealth and telemonitorizations in pilots. We have a growing tech ecosystem, which is already improving in terms of interconnectivity with other clusters all across Europe. We have a solid presence here of biopharma and the tech sectors here in Portugal. And now we've just seen today that I have a very strong commitment from the government to open this, to open data standards, which is quite essential. So I think really we are in this very unique situation. And I just wanted to remind you that if you bring digital and data to the healthcare sector and we combine it with already the leadership that we have in the biosciences and the health clusters sectors, we actually, Europe has a surplus in terms of the exports, that a trade surplus versus the rest of the world in bioscience and health sectors, in health clusters. So basically what we need to do is just bring this on. And really this is a unique opportunity for growth, and growth is going to be the biggest challenge over the next few years in getting back to a new normal. And that's, I think, was the key message for me. Thank you.
Thank you so much. This was a wonderful presentation and a wonderful key comments for a final closing here. I think, of course, we can applaud virtually if you want, of course, and you're welcome. I see applauses, and you can use the feature for the applause in the Zoom. It was a very good presentation, and I think the partners of the Health Data Forum have a lot to speak and to talk. I hope that we can have then after this a sort of a special follow-up meeting, just the partners in the following months. I also would like to thank our advisory board, which is working constantly to have bring the best ideas on this initiative to go and to proceed, and particularly Mario Garcia, who was making a presentation, and of course Rita Veloso also, that was here also in the table of the village, and last but not least, of course, Ricardo Correa from LT Systems, a new recently added partner, also a knowledge partner of the initiative. So welcome, Ricardo, and I hope that the conversation follows. Felipe made a wonderful opening speech yesterday. I hope that Nuno Vasco Lopes can, in a minute, declare officially close this the summit. Just to tell you that Nuno challenged me to do something face-to-face in September. So we have provisionally said 17, 18 September as 2 dates where we can, if not having a session, we can at least have a dinner and invite our guests from outside via video conferencing. But 17 and 18 September, please mark these dates. We want to gather a face-to-face Health Data Forum as a Victory Day celebration gathering, and we hope that then, let's hope to start the COVID-19 after action review, what we need to do now, and then, of course, leading the first steps toward the recovery, as Rocha so brilliantly said, that we have a lot to do here in Portugal that can make us unique. So Cascais is a fixation. We hope that the space will be, the village of Cascais can also be involved in the organization of the summit, and we can have a good venue that is neutral. Of course, our invited region, which is Extremadura, they already presented very interesting projects, and we can learn a lot from what's happening there. They will be also present here. The day one is for relaxed arrival, and then we'll have some keynotes at 7 o'clock for the dinner, and then the next day is going to be the dinner sessions, the work sessions hopefully, and we finalize at 5 o'clock. That is the plan. Let's see if we can do it. I have to thank the summit partners in particular. I would say that every euro that these companies make in sales represents much more than €1 in sales. It represents, first of all, highly qualified job that these companies are creating, which is so important for Portugal. It also represents a lot of value for the healthcare system, because €1 of sales of these companies represent many, many more years in savings, in efficiency in healthcare, in delivering value for the patient. And this is something that I have to remind all the time. Also, in terms of our knowledge partners, Diamede, Medical, they are companies poised to grow, and there's so much to do now. And I hope that we can create a working ecosystem among all our partners to become, to make something meaningful. Also, our strong supporters, they have a very interesting role, and I cannot say the least, Talk and Shine, that support our speakers with a very interesting webinar, and APA, Associação dos Portuguese Hospital Administrators. They are a key element in this digital transformation, and Alexandre Lourenço was here in the morning with us. Also, the INL is Laboratory of Nanotechnology, a strong supporter of this initiative. I thank him so much, and Gerard is still here with us for the presence. And now, Nuno, Vasco, Lopes, without further ado, I think it's up to you to declare officially close this session, and we still have a lights out, okay? So don't leave. I'm going to stop the Facebook Live, but we can stay lights out for 10 minutes more. Nuno? I think you're muted. You're muted. Okay, now go ahead.
So thank you all, especially to Hospital do Futuro and to you, Paulo, for your initiative. Okay, we are just the supporters. I wish you all a great return to the new normal, the new normal in our life, quite different from the past. And officially now the event is closed, and thank you very much again. Okay, thank you.
Thank you. Thank you. Shutting out the live stream now. Okay.
Thank you, everyone.
Thank you, everybody. It was very good to have you here.
Great. Thanks, Paulo.
Okay.
Thanks.
Thank you, Paulo. Yours.
Paulo, muito bom. Opa, eu acho que melhor não podia ser.
Obrigado, Alexandre.
Portanto, pá, temos que continuar juntos neste caminho e temos, de facto, que mudar o paradigma. Eu ainda há bocadinho fiz uma partilha, que eu agora já posso fazer aqui com todos, num grupo de discussão, numa das salas. Pá, a SPEM levou 10 dias a reagir e reagiu utilizando todas as ferramentas do digital. E nós hoje estamos a interagir com todos os sócios de todo o país, estamos a dar estamos a fazer sessões de fisioterapia em telereabilitação, estamos a fazer sessões de terapia da fala em telereabilitação, estamos a fazer consultas de psicologia em telereabilitação, estamos a fazer assistência social, não é? Portanto, as consultas das assistentes sociais completamente online, completamente dirigidas às necessidades de cada das pessoas. Temos a nossa equipa de assistentes sociais está distribuída pelo país e temos a assistente social de Leiria a fazer apoio aos doentes dos Açores, aos doentes de Bragança. E isto, de facto, quando vierem com a conversa que é muito difícil mudar, podem usar este exemplo. Não é? Em 10 dias foi possível fazer este shift.
Esse é um tema fantástico, que é a quantidade de tempo que nós perdemos com discussões etéreas no passado. Tomámos decisões muitíssimo rápidas, de forma muito pragmática, e fomos acertando a melhoria contínua num muito curto espaço de tempo. Eu acho que termos aprendido a viver com a incerteza foi uma nova realidade. Nós estamos habituados a saber a que horas é que saímos de casa e onde é que chegamos, porque o Waze diz-nos que demoramos 1 hora e 5 minutos. Estamos muito habituados a esta lógica de previsibilidade, mas o segundo tema tem a ver com a capacidade que nós tivemos de fazer acontecer. Isto é uma prova de que se consegue fazer acontecer, consegue-se gerir empresas em remoto, consegue-se ter teletrabalho, telecuidados, tudo é possível fazer. É importante que haja vontade e estamos todos empenhados nisso. Está bem? Eu tenho mesmo que me despedir.
Pois,
tenho outra reunião, está bem?
Eu também, agradeço a todos.
Olá,
E olha, eu estou em Cascais à vossa espera, portanto, eu não preciso sair de casa para vos receber. Portanto, venham lá em setembro para Cascais, faz favor.
Vamos lá ver se a Rita consegue vir a Cascais. Rita!
Um grande abraço.
Um grande abraço.
Obrigada, Paulo, pelo convite e fiquem todos bem.
Obrigada, Rita. Um grande abraço.
Obrigado a todos, Paulo. Obrigado pelo convite.
Muitos parabéns, Paulo, mais uma vez.
Muito obrigado. Também nos
Bom fim de semana, Paulo, e para todos também vocês. Tudo bom.
Bom fim de semana para todos.
Obrigado.
Bom fim de semana para todos. Obrigadíssimo.
Bom fim de semana.
Obrigado.
Um abraço.
Gostei muito da sua intervenção.